First came the big, beautiful bill. Now, as Politico reports, Senate Republicans are promising a big, beautiful rewrite. According to The Hill, 5 to 7 Republican senators have already expressed concerns about the House bill because of major cuts to Medicaid. And that was before they found out it also slashes Medicare. At the same time, some Senate Republicans want to go even further, pushing for even deeper cuts than the House version, which, according to the Congressional Budget Office, already kicks, get this number, 13.7 million Americans off health insurance. And that reduces resources for the poorest Americans by 2% in 2027 and increases them for the richest Americans by 4%, all while raising our national debt by more than $3 trillion over 10 years. Democrats warn that's not just bad policy, it's political malpractice, and they had a lot to say about it on the House floor.
Every provision in this program is cruel, and they know it. That's why none of them spoke on it in committee.
When you wake up in the morning, you will realize that you voted to defund Planned Parenthood and to take away health care from 13.7 million Americans. And when this country wakes up in the morning, there will be consequences to pay for this.
When the votes are ultimately cast on that first Tuesday in November next year, that this day may very well turn out to be the day that House Republicans lost control of the United States House of Representatives.
And joining us now is Democratic Congresswoman Lauren Underwood of Illinois. Congresswoman, welcome to the weekend. So, my mom is a former nurse, retired nurse. You're a former nurse. Spell out how this budget plan will affect Americans' health care access.
Well, we know that nearly 14 million Americans are about to be kicked off of their health care, which will be devastating for American kids, devastating because the Medicaid program covers half of kids in this country. We also know that for those individuals who purchase their own health care through the marketplaces, aka Obamacare, they're going to have a real hard time affording their plans because the Republicans declined to extend the extremely popular tax credits that made their health care premiums more affordable. At the end of the day, I think we can expect all-cause mortality, meaning death rates, to go up across the country, and that is nothing to celebrate.
One of the things, few things that I'm obsessed with in this story is the speed at which this happens.
Yes.
One, the Affordable Care Act, by comparison, 427 days to pass the legislation. Inflation Reduction Act, 357 days. An average budget reconciliation, 152. This budget reconciliation so far, 88 days. Now, there were a lot of things that they did during the public comment period. They also did this in the dead of night.
Correct.
They also set the work requirements to start after the midterms.
Correct.
So it seems they know that this is unpopular and still did it.
Well, they don't care.
Yeah.
They don't care about the American people. They don't care about people having health care. They don't care about hungry kids and families. They don't care about the destruction that we're seeing in communities across the country. Listen, Donald Trump has advanced an economic policy through these tariffs that have already made prices increase. And now they are making health care less affordable. They are making food and groceries out of reach for vulnerable families in this country. And I think that it's just wrong. It speaks to their values.
Yeah, because Trump said stay off of earned benefits, stay out of that, and yet here we are.
He literally came to the Hill and he was like, stay the F away from Medicaid. And these guys are like, you can't make me.
Yeah.
You can't make me. This is our bill. And they are gleefully celebrating cutting people off of health care.
Yeah. Now let's listen to what some GOP senators have been saying about this bill, because there's going to be another fight between deficit hawks and those who don't want any cuts to Medicaid. So let's hear that now.
I couldn't care less if he's upset. I'm concerned about my children, my grandchildren, and the fact that we are stealing from them. We are stealing from our children and grandchildren. $37 trillion in debt, and we're going to add to it as Republicans? That is unacceptable. And that's why there's no way I'm going to vote for this bill in its current form.
The House bill is going to add about $4 trillion to the debt ceiling. The Senate bill adds $5 trillion. There's nothing fiscally conservative about expanding the debt ceiling more than we've ever done it before.
I mean, the Senate's going to want to put its own stamp on this. We'll write our own version of the bill. I talked to the president about this last night, and his instructions were pretty clear. Don't cut Medicaid.
So how do you think this bill is going to fare in the Senate?
I think that each of these senators is going to get a little sweetener. We saw it happen overnight in the House, where one Republican member got a tax removed on the silencers. And now we're going to see more and more deadly shootings in this country. They're deregulating, these accessories on deadly weapons as a sweetener to get the Republicans to vote for the tax bill. I think that we're going to expect to see more of that in the Senate.
Congresswoman, I'm sorry. Go ahead, Elise.
I was just going to say, well, Democrats, do you think this is a potent issue for political attack coming into the midterms? Politico was reporting that there's a big digital buy that Democrats are going to roll out ads attacking Republicans on Medicaid.
Well, it's already started. The American people understand what it means to cut their health care. Listen, this is not that complicated. It's not so nuanced that regular Americans don't get it. And the last time these guys came for our health care, we flipped the House. We picked up 43 seats. I was part of that class in 2018. And so, right now, I'm working with the D-Trip as a recruitment co-chair. We are talking to candidates across the battleground. They are fired up, and they're ready to win.
Eugene, have you asked the question yet?
Yeah.
Okay. Look, it is early here in Chicago.
Need to be here sitting in the seat.
No. So I didn't want to take a question away from you, Eugene. But Congresswoman, I want to pick up on something that you just mentioned, that the sweeteners that the Republicans are getting to get them to vote. Am I wrong? There aren't supposed to be non-budget related issues in reconciliation bills, right?
Since when did they start following the rules? Since when does Donald Trump follow the law? I mean, you have to remember who we're talking about here.
Right. Okay. So I'm glad you. So then, fine, sweeteners and all, and we just showed that SOT mash of all those Senate Republicans talking smack about the House bill that's about to come over to them. But I'm just wondering, do you have any faith that all that smack talk is going to continue once President Trump troops up to the Hill, goes to the Senate side, and says, y'all get in line, vote for this bill no matter what's in it?
I would not trust my health care in the hands of Ron Johnson. I would not trust my health care in the hands of Tom Tillis. I would not trust my health care in the hands of these guys. I don't think that they have a lot of credibility when it comes to protecting the social safety net for working families in this country.
One of the things that's really interesting about them kind of keeping the tax cuts, right? But that doesn't give people who are poor more tax cut, like another tax cut. They're not getting anything out of this. They're just keeping what happened in 2017. So I guess I'm interested in if the American people are saying we want more tax cuts, we need more money, we're broke, we can't afford eggs, and they're not doing that.
Right.
Political ramifications for that as well.
Well, right, because instead they're cutting health care for Americans. And, this little child tax credit that they're championing doesn't do nearly as much as what we did in the American Rescue Plan. There are so few children that are going to benefit from this, marginal increase from $2,000 to $2,500. And I don't even think it's refundable. I just think that they're not credible on this issue. This is not a tax plan that in any way rewards working families in this country. All the benefits go to the billionaires. And instead, working families, people who have to go to work every day to put food on the table, are going to be left holding the bag.
And Congresswoman, the debt. It makes all of our economic situations worse because of inflation, interest rates, so many of the ripple and cascade effects. Can Democrats use the deficit hole as a potent political weapon in midterms, too?
Sure. I think it's all on the table for us. I mean, there's no upside here. There's nothing positive. What they are doing is taking a big risk on America's future for future generations to have to pay off. And it's rewarding these billionaires who have never been paying their fair share to begin with. I think that it's a really bad deal. Donald Trump talks about deal making literally every day, and he doesn't seem to recognize how the American people lose.
Oh, man. This is not going to be a pretty negotiation when it happens. I'm very curious to see how those two camps within the Senate reconcile the deficit hawks and the ones who know that this is a political loser when they're up for re-election.
They all know it's a political loser, right?
Yeah.
You can hear them talking about it. But at the end of the day, senators, they don't have every 2 years. They don't have to do it every 2 years. So they have more leeway to ignore President Trump. So we'll see if that actually happens.
Oh, man. Well, Congresswoman.
The Congresswoman said,
No.
Yes, I don't know if y'all heard that.
But can I just say, if people are upset, call your senator. Call them now. Call them on Tuesday when everybody gets back from the holiday weekend, right? The American people have so much power in this moment. Our voices matter in this debate. Make your voice heard.